Your Medicare Initial Enrollment Period is a critical time for you. If you're not fully aware of all the options available to you during this enrollment period, you can make a mistake that results in a permanent annual penalty. Thankfully, the Medicare Initial Enrollment Period is not a complicated subject. In fact, I suspect that by the end of this video, you'll understand all of your options, how to avoid penalties, and be able to make an informed decision about your Medicare. In this video, I will help you to better understand your initial enrollment period, when you can delay enrolling in Medicare without a penalty, and what is your Medicare Supplement Initial Enrollment Period, which is entirely different than your Medicare Initial Enrollment Period. And after that, I'll wrap up with some common mistakes that people make during their initial enrollment period that impacts them for the rest of their lives. If you missed my video on the 3 different Medicare annual enrollments, you should check that out, and it should be linked above and, of course, below. So let's get started. Hi, I'm Matthew Clausen with MedigapSeminars.org. We are an independent insurance brokerage that specializes in Medicare. Our goal is to help you make an informed decision when choosing a Medicare plan, and through our guidance and education, find the right plan for your needs and your budget. Feel free to contact us today. Our services are at no cost to the consumer. So what is your Medicare Initial Enrollment Period? Your Medicare Initial Enrollment Period is when you're supposed to enroll in Medicare Part A, inpatient coverage, Medicare Part B, outpatient coverage, and Medicare Part D, prescription drug coverage. It's also the period of time to choose a Medicare Advantage plan if you prefer that route over keeping your original Medicare. Please see my video titled Your Medicare Choices Explained, which is going to be linked above and below at the, and we'll try and put it in at the end of this video. The Medicare Initial Enrollment Period is a 7-month window that includes the month we turn age 65, the 3 calendar months before our birthday month, and the 3 calendar months after our birthday month. The earliest your Medicare can start is the first day of the month in which you turn 65. Medicare always starts on the first day of a month. For example, if your birthday is April 29th, your Medicare starts on April 1st, even though you're not technically 65 for 28 more days. There are 2 exceptions to this rule. And if you've seen many of my past videos, you will know that Medicare always has exceptions. The first exception is when your birthday falls on the first day of a month. If your birthday is the first day of a month, your entire 7-month enrollment period moves forward by 1 month. And the earliest your Medicare can start is the first day of the month before your birthday month. For example, if you turn 65 on April 1st, your Medicare can start on March 1, a full month before you turn 65. Now, I don't know why that's the rule, but there it is. A second exception is if you're disabled and under 65. When you're under age 65 but have been receiving Social Security disability payments, your original Medicare Parts A and B automatically starts on the 25th consecutive month of disability income. If you have an initial enrollment into Medicare prior to age 65, you will also get a second initial enrollment the month you turn 65. It will be as if you never had Medicare due to under age 65 disabilities. This is important because many states do not offer Medicare supplement insurance to those under 65. Because you get a second initial enrollment when turning age 65, you're then provided with the opportunity to get a Medicare supplement with no consideration for your medical history, no medical underwriting. Everyone is supposed to enroll in Medicare during their initial enrollment period unless they have creditable health insurance coverage that allows them to delay enrolling in Medicare. I'll cover what you need to know about creditable health insurance coverage in a moment, but first, if all this talk about a 7-month window is confusing, I have an easy way for you to visualize and confirm your Medicare initial enrollment period. You can find an initial enrollment calculator on my website homepage. So you go to MedigapSeminars.org and select the drop-down menu from the Resources tab. then select Medicare Calculator. Simply enter your date of birth by selecting the year first, then the month, and then the day. Your initial enrollment period will display below then, as well as your Medicare start date. That same page also has a calculator for your Medicare Supplement Initial Enrollment Period, which I'll cover in a moment. To clarify when you can delay enrolling in Medicare without a penalty, you can delay enrolling in Medicare if you have creditable health insurance coverage, typically through you or your spouse's employer. The term creditable refers to health insurance that Medicare has deemed to be equal in benefit to Medicare Parts A and Part B for health insurance, and equal to Medicare Part D for prescription drug coverage. I have a free worksheet on creditable coverage linked in the show notes below, and it's available on my website at MedigapSeminars.org under the Resources tab. So what I'm going to state next is important to understand. Health insurance and prescription drugs are considered separately for creditable coverage. That means you can have employer health coverage that is creditable to delay the Medicare Part B, but not for delaying Part D prescription drug coverage. Here are two important basics of creditable coverage that often confuse people. One, in order for your employer coverage to be considered creditable for Medicare, your employer must have at least 20 employees. Second, COBRA is not considered creditable insurance coverage. So please see the cheat sheet that I have linked below for details. When I cover some of the more common mistakes that people make with Medicare at the end of this video, it will include how people often mistake their health insurance for creditable coverage when it's not. Next important point or distinction. Medicare Part A is treated differently than Medicare Part B. The reason for this is that for most of us, by the time we reach age 65, we've already paid for Medicare Part A. Medicare Part A is paid for through payroll deductions. When you get your pay stub and it has a deduction for Medicare, that's for Medicare Part A. If you or your spouse has paid that tax for at least 10 years, then Medicare Part A is already fully paid for. The same is the case if you were married for at least 10 years, and your former spouse paid the Medicare tax, then your Medicare Part A is fully paid for. That means there's no monthly premium for Medicare Part A. Now, if Part A inpatient insurance is paid for, Medicare really doesn't care when you start your Part A coverage. You can start your Part A coverage and delay Part B if you or your spouse have creditable employer coverage. You can technically enroll in Medicare Part A at any time, as long as it's paid for. While there is a penalty for not enrolling in Medicare Part B when you're supposed to, there is no penalty for late enrolling in Medicare Part A if it is already paid for. However, Medicare Part A has a quirk, one that can really mess you up if you have an HSA, a health savings account. When you enroll in Medicare Part A after your initial enrollment date, which is the earliest date that you can start your Medicare, Medicare Part A will have a retroactive enrollment date. So what it is that Medicare Part A will start either 6 months retroactive to your application or on your Medicare initial enrollment date, whichever is soonest. So let's go over an example to make this easier to visualize. Let's say that you were born on January 10th. That would mean that your Medicare start date would be January 1. If you enroll in Medicare during the first 3 months of your initial enrollment period, which would be October, November, or December, before January, then your Medicare Part A and B will both start on January 1. If you enroll in your Medicare after that, like sometimes in April, which is the last month of your 7-month initial enrollment period, then your Medicare Part B will start the first of the next month. It'll start on May 1. But your Part A will start retroactively by either 6 months or your initial enrollment period, whichever is soonest. And since your initial Medicare start date is January 1, which is less than 6 months, then your Medicare Part A will start on January 1. Next, let's look at how you delay enrolling in Medicare, and then I'm going to cover your Medicare Supplement Initial Enrollment Period, followed by some common mistakes that I hope you'll avoid. Before I do, just as a reminder, if you like the information that I'm providing and the way that I provide it, please let YouTube know and show your appreciation by pressing the like button below, commenting, and sharing this video. Thank you in advance for doing so. If you are working past your initial enrollment or past age 65 and have creditable health insurance, your employer is supposed to send you a letter of creditable coverage annually. Please keep a copy for your records. Whenever you're ready to switch to Medicare full-time and quit your employer coverage, you will need to complete Form CMS L564. It will need to be signed by your employer. Using this form creates your own private special enrollment period. A quick note, if there's some reason your employer cannot or will not sign this form, speak to the people at your local Social Security office for a resolution. And that does happen more often than it should. The form CMS L564 officially notifies Medicare that you had creditable coverage and are not subject to a penalty for Medicare Part B and/or Part D. The first page of the form includes directions on how to complete it and submit it. It really is very simple. Now, I've included a link to this form in the show notes below, or you can simply search for CMS-L564 on the internet. Next, let's cover your Medicare Supplement Initial Enrollment Period. The Medicare Supplement Initial Enrollment Period is a 180-day window where you can enroll in any Medicare supplement plan that's available to you with no health questions asked. There's no medical underwriting. So this Medicare Supplement Initial Enrollment Period is triggered by your Medicare Part B start date. Your 180-day countdown starts the day your Medicare Part B coverage starts. It does not matter if your Part B starts when you turn 65 or if you've delayed your Part B until you're 80 years old. Your Medicare Supplement Initial Enrollment starts the day your Medicare Part B starts and continues for 180 calendar days. Earlier in this video, I showed you where you could find a Medicare Initial Enrollment Period calculator off the Resources tab of my website, MedigapSeminars.org. That same page has a Medicare Supplement Initial Enrollment Calculator for you as well. After the 180-day initial enrollment period, you can still apply for a Medicare supplement plan any day of the year. But in most cases, you will be required to qualify via medical underwriting. The insurance company can turn you down if your health history includes recent critical or chronic disease. Now let's go over some of the more common mistakes that we see most often that are easy to avoid. First and foremost is the mistake of enrolling in Medicare Part B coverage with your employer coverage. Why is this a mistake? Because your 180-day Medicare Supplement Initial Enrollment countdown starts the day your Part B starts. We see way too often people who had both Medicare Part B and employer coverage, and by the time they decided to quit their employer coverage, a health event had occurred that would disqualify them from ever getting a Medicare supplement. As such, their health choices were limited to just having original Medicare or trading in original Medicare for an Advantage plan. Their ability to get a Medicare supplement, considered by most as the best option in Medicare, was gone forever. The lesson: do not start Medicare Part B until you're ready to have Medicare as your primary full-time coverage. The next most common mistake is assuming that COBRA coverage is creditable and then missing their entire enrollment period. COBRA is not insurance that is creditable at this time. So do not delay your enrollment into Part B or Part D if you have COBRA. The third most common mistake is failing to enroll in Medicare Part D prescription drug coverage because you have no current need for medications. This is way too common. While there's a small financial penalty for failing to enroll in Part D when you're supposed to, the biggest penalty comes when you need Part D and you don't have it. You can't simply start Part D whenever you want. After your initial enrollment period, you can only sign up for Part D during the annual enrollment period to start the January 1 of the next year. If you get cancer or any number of serious chronic disease, the cost of the drugs alone without Part D can bankrupt you. and I've seen that happen more than once. Filing for bankruptcy and retirement is a disaster, especially when it could have been easily avoided by spending just a few dollars a month. All right, we've covered a lot in this video about your initial enrollment period. There are more enrollment period videos coming. I've already done a video on the 3 annual enrollment periods in Medicare, and there are upcoming videos on special enrollments, on birthday rules, and more. Please like and subscribe and click on the bell icon so you don't miss out on the upcoming videos. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.